The aging column, a structural analysis of cervical spondylosis. Cervical spondylosis is a thing that affects the human spine. It basically means the degeneration of the spine, and we're going to be focusing on the neck area of that. So cervical spondylosis means the degeneration of the neck itself. You may have read X-ray reports or MRI reports of that mentions cervical radiculopathy or myelopathy or cervical spondylosis. Cervical spondylosis means degeneration of the spine. Radiculopathy means that you have a pain, a nerve that's been radiating pain and it's being squashed and irritating. So radiating pain down the arm or numbness in that matter. Myelopathy means that you're having some issues where the spinal cord itself has been compressed and more often affecting your legs. So these can sound some scary terms, but we're going to go through them and explain them in detail what they are. What they call it the aging column. It's considered to be an age-related problem. It's considered to be normal to have cervical spondylosis as we age. I would say that's not the case. It's very common, but I would say that it's not normal. So if you look at the next slide over here, we have a 14-year-old girl on the left side and in the middle before or after I treated her, and then an 86-year-old lady on the right-hand side. So if you look at here, the 14-year-old, you can see that she has cervical spondylosis already. She has degenerative changes in the segments already where the neck is bent the wrong way. The other segments up above it and below looks normal. But where the stress point is, that's where she has degenerative changes. When you look at her after I treated her, you can clearly see that these segments are lower in height than others. So she already has degenerative changes at the age of 14 itself. If I then go look at the 86-year-old, you can see her X-ray over there. She has really no sign of degenerative changes. No teeth, that's not my problem, but if you look at it, extremely healthy. So I would say it's more of a structural problem. It's a structural related. It doesn't matter that the age that you're having, and we're going to go into detail why this actually occurs, why the structure is more important than your age when it comes to this. So who am I? I'm Chiropractor Kalla. I've been in Singapore since 2006 practicing. And I've been practicing chiropractic care since 1997, since I graduated. So I have a couple of decades of experience of treating neck cases and spine cases. So currently I have a clinic, Dr. Neck Pain, in Bugis here in Singapore, where I'm treating a lot of neck cases with cervical spondylosis, radiculopathy, and myelopathy itself. So structural, looking at the case of a normal spine. So let's go into detail here. This is how a normal cervical spine looks for. And what you're looking for is the person facing towards me now. You're looking at the side view. You see these segments over here, the nice healthy disc gap. This is how a normal spine should be aligned when you're looking at an X-ray. I can magnify that for you so you can see a little bit better. You can see everything looks nice and healthy over there. And then what happens is, this is how an X-ray can look like when you have this big bone spurs, looks very spiky, very thorny, looks very unpleasant itself. So we magnify them so you can see over here. This is normally then aligned when the spine itself is bent normal. So what happens in the first initial stages is phase one. They call it desiccation. What happens is basically you're losing water in the segment here. So you're losing water, you're losing some of the gel structure. It's starting to get older and harder. So you're losing some of the dampening effect of the spine. What happens in the second phase, when you start losing the dampening of the spine, the segment itself starts losing disc height. You have kind of a load transfer. Less of the load is borne by the neck. The neck starts going more forward itself, kyphosis, and you have more pressure on the facet joints and the other supporting structure. And since the spine doesn't like that extra support, extra pressure and instability, what it does is trying to provide stability by creating the big bone spurs. So why does this happen? Sorry, went one too far here. So if you look at a research paper, this is a great research paper, actually published last year. Let me read the title here. Biomechanical rationale for the development of cervical kyphosis deformity, a finite elements analysis. So what they're using computer models to look at what happens to a spine and how the spine looks like when certain things happen and what kind of pressures are involved. So if you have a normal cervical spondylosis, the spread is actually loaded on the spine. Now this patient is facing away from me. So they looked at the spine with a 25-degree arch here, and how the stress areas. And the primary stress area is in the middle of the neck. But these are within normal load levels. So this you can have a healthy spine for the rest of your life. Then they look at one when they make it almost straight with a 3-degree curvature angle. And you started seeing some forward head posture, and you started seeing some stabilizing function of the facet joints, the joint capsule at the back point of the spine. Excuse me. But what happened here when the neck started to bend forward? Actually, it's supposed to be 8-degree angle. There's a typo, so it's supposed to be 8-degree angle. What we could see massive increases of pressure in the upper cervical area. 71 times stress increase in the C2, C3 joint area. So causing degeneration. Not only that, you have a disc area here, facet joint areas in the C6, C7 area by 356 times in this digital model analysis. So why should we believe this? Well, we are using finite elements analysis when we're building car, deformation controls, car crashes, airplanes, F1 cars, racing cars. So we build all these digital models and we keep verified with real world data. So these finite element studies, digital model, are pretty accurate and pretty good these days. So that's how we can start measuring these pressures that's happening. So this is actually the first time I see a spine that they looked at it, the 3 different configurations of it, and they made a digital model. So what they took they moved it to a person and they put them in the CT scanner. So they digitized the whole bone structure of her neck, and then they changed some parameters and structures of it and measured how the pressure would be translated in there. And that's why we can then see when you're having pressures like this, these are very unhealthy pressure levels, and this pressure is 40 times higher than normal. So this explains that we're having such high stress levels and why we start having degenerative changes because of this happening. So it's not that the structure is wrong in the bone for yourself. It's the individual components, not the material that is wrong. If you look at here, the structure fails not because the material is weak, but because the geometry is inefficient. So what happens when you have a nice neck curvature in your neck, you have a nice even bridge like this, the loading is evenly spread throughout the whole area. But when you're having cervical conformity, when your head starts shifting forward, it's almost like you're just holding everything in one end and you have the stress point increasing it. So you concentrate all the stress in one point, and that's what happens when you're losing the normal cervical lordosis. Your neck curvature is lost. And that's why you start having this cervical spondylosis and degenerative changes in your neck, as you can see. So what is it happening? Radiculopathy, peripheral. Think something distant. So it's pressing on the nerve that already exited the spinal cord. So you look at the nerve, if you look at the segment, the disc at the front, these are the facet joints, and the nerves come out here in the foramen, neuroforamen. So the nerve is then being pinched there. Sometimes because of gel bulge or disc herniation, slip disc, you may hear the term, or you may have other bone spurs growing and irritating it. So peripheral. So that's where the nerve is pinching, and you have numbness or pain down the arm. Myelopathy, think more central. So if the disc bulging, irritating, or bone spur started to encroach the spinal canal here and directly pushing the spinal cord and front. I should have put an MRI image here, but where we can clearly see then the bulges. There's a slide later on, we'll illustrate this. But those are the 2 main things that we're looking for. What happens, the symptoms is here, radiculopathy, is you have pain, sensor, or motor loss. Okay, you may have nerve weakness or when you do a reflex or something like that. That's more specific. It's usually one segment, one nerve at a time. When you have myelopathy, it's more central. So it actually functional loss, and you can have some spastic gait and other consequences. So how do we look at radiculopathy? It's the wiring of your arm. So you can look at the sensation of the arm. So if you look at the dermatomes, where the different nerves covering, shoulder area, deltoid, you're having your thumb actually here, number 6. So if you look at here, you can look at this as a number 6. Okay, look at the circle here. That would be your number 6 nerve. Finger 7 here, and these 2 fingers, the ring and the index finger, pinky finger, that would be dermatome 8. And that's when you then cover that area and so on. So that's how we're looking at the spinal dermatomes covering different segments. So that's how we can determine what nerve is being caused based on where you have numbness or where you're having pain, you're feeling. So there you can do a couple of tests to look at this. So if you're having a problem here, what you're looking at, let's say I have a problem in this area. I can extend my neck, turn away, and then apply some compression. If that gives you a relief, it's called a positive test. And then we know that there's a foraminal issue and you're having radiculopathy in that area. Another one is just putting that, let's say you're having a problem here I can just apply my nerve, and that in itself, because I'm shortening the nerve here, putting less pressure on it, and that gives relief, then we know that it's also positive in that way. Just a few different tests you can do to differentiate what's the problem. Another one is called distraction test. When you're lying down, the doctor, therapist, something, they can just slowly pull your head, distraction here, allowing it. And if you're getting more problems from that, then we know also that's positive when your pain is increasing or numbness is increasing. So that's the distraction test, what you're looking at. So myelopathy, what we were talking about, what I mentioned before, that you have the disc bouncing. So this is clearly how you would see an MRI view. And you would see then that there's a bouncing into the spinal cord. And if that's too much, you will have different kind of issues going from that. So I've been working with a doctor for now, orthopedic surgeon, Dr. Feng Shiyan. He got some, I think he got a silver medal from the Singapore government for the work that he did at Tan Tock Seng Hospital. And so what he gave me as an advice for people, we will cover it in the slide itself, is that if you put your hand in your pocket and you can't feel the difference between a key and a coin with your hands, you probably need surgery then. That's where you kind of differentiate. You've gone so far that you can't discriminate between two different points, what is what. And that's when you're having too much cord compression, that you're having some issues, and that's the time to go for surgery. So if you're having problems with those things, don't delay it, okay? There can be some severe consequences and permanent damage if you delay further than that. So, myelopathy, sign of function over pain. So what they're saying, you have problems with smart motor skills, buttoning shirts, you may be clumsy, dropping things. So these are all the signs of motor skills happening or myelopathy that is happening. And some people are having spastic gait. So normally when we're standing, unfortunately you can't see my feet, but your feet would be fairly nice together, between 2 to 4 inches apart. When you're having myelopathy, there will be more plowing. They put their feet like more than shoulder width apart, and then they're slowly walking like this, and very unstable spastic gait because they're looking for feedback and balance to correct the issue. Because what happens when you start compressing the spinal cord, it affects your lower legs, and they start becoming more spastic, the reflexes, when you test them. So how we'll look at the diagnostic level, the reflex here again. So radiculopathy, root. Lower motor neuron, you can have distant, diminished or absent reflex. So when we hit a reflex, nothing happens. It just flaccid. Okay, and if you compress it too hard, it becomes almost like polio. You completely vanish the muscle. And you can very quickly start disappearing muscles if it's really, really bad. So when you're having issues like this, don't delay and wait, okay, I wonder what it is. No, you need to go get surgery. If you have a complete abscess of the muscle and start shrinking, you need to go surgery because it can be permanent nerve damage that cannot be repaired. So you should go there really quickly. Also, one other one, if you're having, since we're talking about nerve compression and all that, if you ever have problems controlling your bladder or bowel, you got 4 hours to go get surgery done. So this is not a joke to start delaying things and things. It's not a problem. I'll do it tomorrow, next week, or anything like that. If you have some severe issues, go check it out. Better safe than sorry. For myelopathy, upper motor neuron. So what happens is that your nerves get too excited. They're more ecstatic. So when you do them, they can be more aggravated because you don't have the dampening effect from the upper motor neurons for your lower motor neurons. So you have desegmentation happening in your spinal cord. And once you cut that off, they get more spastic. And that's why they're affecting their walking. Oh, this is actually quite funny. Of course, not funny, but what they're doing is that you're testing your hand over like this. And if you can't hold it, this test is supposed to be done for about a minute. And if you can't hold it, the fingers start abducting. The fingers start going sideways like this. Okay? And in some cases, it might be going that the ring finger follows. Maybe that's a hidden Spock gene that you're having from Star Trek, but for being a Vulcan. But yes, so if you can't hold this for a minute and it keeps that the fingers start drifting, that would be considered a positive sign for myelopathy issues. Then there's some other tests you can start looking at that, but that's called the finger escape sign. So ruling out imposters. When you're having symptoms like this, you can have some severe issues also happening, and that's one to be checked out. For radiculopathy, it can mimic sometimes rotator cuff tears if you have something torn over here, they can be delicate as we get reaching up into age 50, 60, 70 years old. There's a good number of people that are having this tendon being torn over there or partially torn, and they can give pain, weakness, all kinds of symptoms. So you need to look at it. Or peripheral nerve entrapment, meaning that you can have entrapment in the elbow, carpal tunnel, or other things where the nerves are going through some pinch points. And you want to be looking out for those. Also, one more that is not being shown over here is trigger points. You can have trigger points in the scalene muscles most commonly. By pressing over here, you can have pain down your chest, but also pain down the arm, but in some cases also numbs. And it can go all the way down to the fingers. I see a lot of these cases, and they often get overlooked. And when you start treating them, and you have some irritation, the pain, the doctor may see that you have an inflamed nerve or something like that, but that's not the case. Actually, trigger points. There's a whole book of literature about that. General Travell that wrote the book about it, the Bible basically about it. She used to be John F. Kennedy's physician back in it. Very reputable and credible lady, and wrote those books. So that's a differential diagnosis you want to be excluding, that it might not be a problem. And for myelopathy, ALS, Lou Gehrig syndrome, severe issues. Multiple sclerosis. I think there was a correlation of people having myelopathy of 33% had MS issues. So this is important to look at that are these contributing factors, what are these going to getting the right kind of treatment and not getting the wrong treatment, letting certain things progress as they are. Vitamin B12 deficiency, yeah, I'm not very familiar with that, but I guess that they will check that when you go to the hospital to rule that out. So what are the points that you'll be looking at? Pain dominant, think radiculopathy, think pinched nerve, pain on the arm. Clumsy hand, think myelopathy. So if you're clumsy, you can't put your buttons on, you can't feel what the key or coin is in your pocket, then think myelopathy. Weak reflexes, think radiculopathy. Pinched nerve again, poor signal, makes your reflex weaker. So that's what you should be looking at. If you're looking hyper reflexes, Babinski, it's a test you're doing for your foot, but it doesn't matter. Think myelopathy. So you need to differentiate what you're dealing with exactly. And if it's too hard, the myelopathy, you need to go for surgery. Sperling's test, that's again, we're testing when you're putting your head backwards and turning away, and then putting some compression there. And Lermit is positive myelopathy. So basically what you're doing, this is your chin to your chest. And if you're doing that and you feel some electric jolt going down the spine or down to your arm or even in your legs, that's considered positive Lermit test. So conclusion, stabilized column. So what the spine wants to do, it wants to stabilize areas here with bone spurs because it's losing that. So when you have loss of normal curvature or age or whiplash, that you create instability, the body wants to create stability and it starts putting bone spurs. So when you have these excessive pressures that are happening, it's like you ladies wearing high heels, you get these bunions in your feet and your toes because you got these pressure points. So same thing happens with the spine. It starts putting some calcification, bone spurs building up to create stability to deal with that extra stress and load. Same thing for men. If you're going to the gym and you don't wear gloves and you get these calluses in your hand, same thing has happened in there. So same principle applies in your spine. That's how you start doing degeneration. Again, what I wanted to say, it's not an age problem. It's more of a structure that is causing over this. And this is, we'll look at how the bone spurs happening here because that's the stress points. So think again the calluses that's happening here. You can see the bone spurs growing here. You can clearly see it more over here in this area. So if I just magnify it for you, sorry there, you can see this bone spurs, oops, there. Okay, and then if you're having a normal neck, you basically have healthy neck throughout your whole life and don't have any issues with degeneration really. So what I do for people having these degenerative changes, here's a neck. She was actually hospitalized in the Middle East for 10 days. She was sedated. They wanted to operate her neck. You can see that she clearly has a bit of a bulge of the spine the wrong way, and she has bone spurs over there. She was 58 years old. So she came to see me. I treated her, and I made her neck look like this. Perfect lordosis again. Get the load pressure in the balanced out by proper geometry in the neck, if you remember the previous slide with the arch bridge. So this load is spread out evenly. She went to work, back to work within a month. I spoke to her 6 years after I treated her. She didn't require any further treatment. She was perfectly fine. and she was 64 at that age when I spoke to her the last time. So that's the power of restoring normal curvature. We can stop the process of degeneration when we start spreading out the load evenly in your neck. Second person over here, massive forward head posture, a lot of stress and strain in the upper cervical area, the top of the neck. You can see big bone spurs over there in the C2, C3 area. Correlates with the model that they had over there, that there was increased pressures in that area, region. What I made him look like that in the middle slide, that's him, much better neck, far less forward head posture. This is how he looked at after the first 12 treatment session, after 4 weeks of treatment. Then I further treated him a bit more than that, and we could get the neck to be a normal curvature. Interestingly, what happened in the first time when he came in here to see me, we measured his hand grip. His left hand, non-dominant hand, measured a hand grip of 40 kg pressure. He could do that. His right hand, only 24. So he started to become clumsy and dropping things. After the first month of treatment, after the first 12 visits, we measured again 40, and he was 30 kg on there. So he had already improved significantly. After a couple of months, he had become, 2 months, 3 months, he was at 40, 38. So we had restored his normal pressure. And by the time we managed to fix his neck back to normal curvature, like you can see in the far right slide here, over here, his hand grip had gone to 46 non-dominant hand and 46 on his dominant hand. So we improved the nerve signal to his hand, and the muscle could function optimal. That's the power of fixing the neck curvature and stopping the degeneration. So what happens when you start having cervical spondylosis or neck pain or other things? Your neck is not working right. The structure is the problem. So remember that. It's not the age. It's the structure that is the problem. What I do, I fix the structure for you. You then make your neck work again, and that's how your neck can start healing, and you can regain your power in your fingers, your hands, and your pain will go away and your numbness. So thanks for listening. Again, I'm Chiropractor Kalla. I have a clinic, chiropractic clinic, Dr. Neck Pain in Bugis here in Singapore. So yes, if you need any help with this, let me know. Thank you.